Welcome to the What About Rural Health podcast, a place where research, policy, and real life stories come together to ask the critical question: what about the communities too often left behind? I am Chinasa, a development and global health policy strategist. And for me, this work is personal. From the village health workers struggling with limited supplies to the mothers walking miles for care, their stories shape the policies we need. Join me as we uncover challenges, spotlight innovations, and amplify the voices of those at the heart of rural health systems. Because every community matters, and it is time the world listens. Hello and welcome. You are listening to the podcast that asks the question many forget to answer: what about rural health? I am your host, Chinasa Imo, and together we are uncovering the stories, challenges, and innovations shaping healthcare in overlooked, underserved communities. Today, we will be discussing digital healing, innovating rural healthcare through technology, music, and community building. And we have Dr. Jean Junior Eye Ngoa. Dr. Ngoa is a Cameroonian physician, researcher, and health innovator. So we are running this episode on the theme Stories from the Field and Innovation in Rural Healthcare. So I'll introduce you very clearly, and Dr. Ngoa has a very impressive resume. Like, when I look at his profile, I'm like, wow, there are so many young people doing so many beautiful things across Africa. And he is the best fitted person to take on this first series of our podcast recording. And here we are. We reached out to him and he accepted. Dr. Jean Ngoa is a purpose-driven medical doctor. He's also a digital health strategist and a global health advocate who is committed to transforming healthcare across Africa. He is the Chief Medical Officer and Regional Director for Central Africa at the Afromed Academy of Medical Research and Innovation. He leads a powerful program that is tackling malaria, HIV, and digital health challenges. And the founder of the Health Digit program, he empowers healthcare professionals and institutions to build strong digital identities and promote digital health innovation. His impact has extended to the University of Washington's e-learning program, wow, where he supports the training of over 2,000 professionals across the continent, as well as participants in more than 10 local and international. He has participated in more than 10 local and professional conferences across the world, and this would include him being on TV shows, promoting primary interventions, and leading health and community outreaches. He also holds several leadership roles, including being the vice president of the Cameroon Young Physicians Network. He's also the board member of Africa Suicide Prevention. He's a member of the World Medical Association and associate researcher and general coordinator of the Age USA e-learning program at the Triad Research Foundation. I do not need to reemphasize that this young physician is passionate about bridging science, services, and technology. And he's doing that uniquely by blending clinical leadership, innovation, and community engagement to every stages of his work. So, Dr. Ngoa, I want to start by asking you this question. In your profile, you mentioned a story about your grandmother's leukemia as being something that shaped your career. And would you tell us a little bit about that before we dive into the podcast proper?
Okay, thank you so much, Inessa Imo. And I want to say hello to everybody who is leading this podcast. I hope you are going to enjoy this 40 minutes, 1 hour with us. It's such a pleasure for me, and I would just like to say at the beginning of this podcast that social media is a changing lives nowadays. And now to dive on the questions you asked me before, I would like to start on saying that whether through a stethoscope, a smartphone, or a violin, because I'm violinist, amateur violinist, and I found in the past, now 3 years ago, Medical Art Academy aims to have professionals, yeah, to incorporate music and therapies um, in the medical healthcare, and we all hold tools that can heal, connect, and empower. So my journey personally, from losing my grandmother to glaucoma to founding non-medical art academy and health digital program, has taught me that innovation doesn't always require advanced tech or big budgets. It requires empathy, it requires courage, and it also requires willingness to act. And if we equip our communities with knowledge, inspire them through purpose, and connect them through technology, we can transform even the most remote health system. And you don't have to wait to be powerful to make an impact. Start where you are. And with what you have, because in the heart of every rural village is a solution waiting to be seen, supported, and scale. Let's lead that transformation together. Please, to close this questions, I would like to say thank you for all my mentors, especially Dr. Ngwana Naima, Norris Ebanda, Open Grips, who is my heartbeat organizations, Afro Medical Research, Cameroonian physician, and I would like to say thank you to everybody who helped me every day to continue my mission, to support me, who cross me, who is there even when it's raining or not. And yeah, so thank you so much, the bottom of my heart.
Thank you. I like when you mentioned that health technology mustn't be this, big thing that is so costly. So let's discuss that and talk a little bit about the role of digital tools. I'm not going to use the word technology, but saying the role of digital tools in improving rural health care. And I have seen that you have led so much advancement in e-learning programs, and I would really appreciate the idea behind using e-learning for healthcare workers in places where there are, limited healthcare providers and trainers on ground. And how is e-learning bridging that gap?
Yeah, thank you so much for the questions. And I would like to say that I've been now a site-based coordinator for the AGS program related to the Cancer Foundation and Washington University in USA. Now, for 3 years ago, I have been able now to empower health professionals and beyond, and even my colleagues. At that time, we was just we were around 3 coordinators, and nowadays I was able around to train other coordinators, and our sign is around one of the best site-based coordinations and in sub-Saharan Africa and even in Africa. And first, I would like to say something. First is digital exclusion. Many rural providers lack reliable internet or device. Yes, we know nowadays there's not industry, there's not a companies without energy. And many countries nowadays run to find energy, to find new energy, to find all these possibilities around the world. And second is training relevance content is often not tailored to local realities. And that's why we always try to find local communities leaders who are running. For example, we have this program, Leadership and Management in Health, or Project Management in Global Health. All the time, at the end of the trainings, we always try to find local leaders who are running projects here, maybe for 3, 4 years or many years ago, to come there and share their experience with the new trainees who are there to help them not to bridge the gap between terrorism practice. Because you read something, you learn something in the book, and you need not to picture how this thing looks in realities. And that our expertise now would take place. And through our work with the University of Washington and Chestnut Foundation, because I would just like to mention that now I'm a general coordinator now. So I started as a facilitator, coordinators, and general coordinators now. And I hope in a few months, because the university want to appointed me now as an AGS partner. So that means I will dive now at the levels of policies and excuse me, the sustainabilities of our site. And we've aggressed both by offering hybrid training in local context, mentorings over 2,000 plus health workers. As you said it at the beginning, we've told that they can apply immediately, you know, because the ideas of a site base is to put together professionals who are working in a specific area and lack some skills. So then we skills them to help them now to really put in practice those what they have learned now to improve the health in their communities, their organizations, or what they are doing. And I would like now to end with the Health Digital Program, because I'm a Young African Leaders Initiative Regional Leadership Centers alumni. That's program that we've been run by the former president of USA, President Barack Obama. I received that scholarship in 2024, and I spent something like 4 and 5 months there, train myself to be a community leader. And I made that observation that many of medical health professionals in our communities lack to the realities, because we picture medicine like in 1960, and nowadays we can practice medicine without digital aspect, without social media. And due to the way that a lot of people are now on the social medias, we have now to adapt ourselves, to train ourselves, and continue now to follow people's, whether they're in online or in the realities. So then our Health Digital Program was born from a simple realization. Many brilliant African health professionals lack visibility, for example, or digital skills. So by training them in the context of creations, social media strategies, and digital branding, we enable them to amplify their voice. Yeah, because your voice matters. You have something to give to the communities. So I don't say I don't have anything to bring. No, because everybody, I always like to set this chord and be the change you want. Everybody is a health ambassador. It is not only the matters of those who have been trained, who have trained themselves as a medical professional or health professionals. No, when you receive a good information and you will be with your relative, your friends, and you say something, you will see this thing and you say, I know this, you can do this. You share with the person the right information, and then you become a health ambassador. So this vision aligned with the sustainable development goals, where making digital health not just accessible but actionable. So thank you so much.
Thank you so much, Dr. Ngoa. You really drive to the point that using digital health improves accessibility, especially for communities where routine traditional healthcare is limited or lacking. You are still listening to What About Rural Health, and we'll be right back. We're just taking a short break. Welcome back. You are still listening to What About Rural Health with Chinasa, and we will begin by asking a question. Dr. Ngoa, what inspired you to blend medicine with music and mental health support?
Okay, thank you so much for this for this wonderful questions. I'm laughing because that questions are always comes across me, even when I'm on TV shows, in the communities, and this is a curiosity because people don't uh, don't want to read to me just because I'm a medical doctor, because I have something extra. And what inspired me to blend this? Uh, okay, let me go back far. As far I'm going back to my personal journey. It began with my personal experience, a grief after my grandmother lost her vision to glaucoma. Yeah, excuse me if I'm talking. I'm always talking about my.
It's okay. It's a story that is inspiring us.
At that times, uh, I was depressed. Yes, music became a refuge and later and a therapeutic tools when I became a physician now. So then it was one of the main things that motivated me now to engage myself in the healthcare domain, because I always told myself, if I was a medical doctor that time, I think I, I could do something for her to save her lives. That is just dreaming as a yes, as a younger person. So when I became a physician, I realized that mental health, especially in rural and deserved areas, is often overlooked. You see it. Did you see it? And founding the Medical Arts Academy, I have now 1,000 plus followers in Facebook. It's true that I'm not very, very active there, but I'm very active on LinkedIn due to my new objective and my new vision. Uh, Medical Arts Academy allowed me to merge my passions for healing and art. Yeah, it's just because that here we are following a certain ethics. But I would like to show you in the back office some video of how I'm working with some patients in that area, so you can picture that one. I think so you can also show my personal LinkedIn, and you can see some of publications that I have the right to publish them here. And today, we use music therapies, especially violence instructions, to support patients with depressions, maybe in oncology, to anxiety, trauma, and helping them to express, heal, and to connect. Not only because we have active music therapy, and we also have passive music therapy, and we always try to adapt it to the person's stories. Yes, because a lot of time people will ask you, oh, when you're doing music therapy, does it mean that I can you can come with any song? No, no, because this has to be related to the personal stories of the person. The person has to find himself to what you are doing, and that's why what we are doing have all the meaning, or the sense of purpose, the sense of healing people and our patients. So that's it. So thank you so much.
Thank you so much for that response. And yes, when you mention active and passive music for healing, I myself am someone who is invested in music. Like I consume all genre of music, and I know that I like to listen to and digest different music depending on the mood that I am. Sometimes, if I want to go into a depressing mood, because sometimes, that place brings you to think, just, you know, slows down your time. There are some very slow music that someone would think is a depressing music, but that produces a kind of alternate healing where you're putting yourself in a state where you foray your mind to think very deeply and brings out all your emotions into your thought process. So I really appreciate when you mentioned that. So let's come back to digital health. How is digital health program changing how African professionals and NGOs approach health communication?
I would like to to start with my personal experience. Some years ago, I applied as a scholarship, and that scholarship, I supposed to receive something like $30,000. I will not mention some information there. I'll just stop there. And one of the core value of that scholarship, uh, you have to, you don't have to tell your story. They want you to show your stories. And at that time, for me, LinkedIn, for example, LinkedIn looks like just that place where you are just here to spending your time when you don't have anything to do all that time. I didn't have that conscious that it's a place that can change my life, that can change lives, that change lives and uh, help people to show what they are doing and yeah, to build a network. And uh, I decided to send them an email. So upon the time they sent me what we call the beloved email. The beloved email, they said, okay, thank you for your application for this, to apply your program. And we really like your journey, your CV. And at the end, they'll tell you, sorry, we're not able to give you the scholarship. And you say, oh God, all this long message to say this, that thing. But I didn't stop there. It helped me not to fight to refine myself. And that's why as I took a training as a social media manager and I specialize myself on LinkedIn especially. And then this changed my vision and the way I picture healthcare radically. Radically. And when I realized it, and I start if you check my LinkedIn now, just around 6 months ago, I have now 30,000 in plus followers, and a lot of people type me trust on LinkedIn. We are seeing what you are doing. We know this. I want you to make podcast. I want you to do this, to do that. And then now I realize the powers of social medias. And one of my aim nowadays is to tells our colleague, especially when we are in under resources, to tell them now, yes, you don't need somebody to to find the opportunities for you. You are the opportunities. Show what you know, even if it's just small. You can share it with passion, with engagement, with your contributions inside. And then there will be somebody's there who is just seeing what you are doing and say, I want to work with this person. But if you fight, you know that there's a possibility to win. But if you decided to rest your case, you know that you lose without the war started. You see it. And it's your responsibilities. You have that superpower, as one of my mentor, Oprah Winfrey, always said. Yes, she's one of my mentors. I have never met her, but her podcast transformed my lives. And I like this quote. Go inside yourself and find that superpower that makes you unique and show it to the world. Nobody will give you the opportunity until you show them, until you give them the reason that I deserve this opportunity. That is what I would like to say at the last one about this question. So thank you so much.
You're welcome. Thank you so much, Dr. Ngowa. We are going to take a short break and come back. Welcome back. So, Dr. Ngowa, what are some of the challenges rural health workers face when it comes to accessing training on online or digital platform? What have been the challenges that you see rural health workers face?
Okay, thank you for the question. And there are many challenges. I will just try to name some of them based on my personal experience. The first thing is network. Yeah. For example, here we are recording a podcast, and from time to time you can have the network challenges. So if we want to to really move from one step to another. So we have to address that issues of energy, the network, the matters of data. We also have the energy. Yes, you have some localities where there's not light, there's not network, there's not anything. And you have people who are living there for many, many years. And if we want to address the sustainable development goals, three, fours, and tens, what are really engaged uh, to we we have to address that question holistically. Yes, so it's not just the volunteerism of the communities to build a healthier communities for everybody's. It's a volunteer of everybody's, even the government, the policies, the way the founders, and we also have to encourage. There's also a lack of initiative, personal initiative. And when I say personal initiative, I would like to talk about the inclusions of communities to be engaged on their personal health. In my experience, I, I always face this aspect that people don't know, they don't know about their health. So we have to find solution to educate communities and to help them or to engage themselves for their personal health. Yes, how they can do this simply. We always say that prevention is better than cure. Prevention is better than cure. So for me, primary prevention is the backbone. Primary prevention is for a good health system, what the cells is for the body.
Thank you very much. You are listening to What About Rural Health? We'll be right back. Do you want to help drive rural health forward? We are looking for passionate volunteers to support our work, from research to storytelling to aggregation of stories and data from rural communities and for outreaches. So if you believe every community deserves care, join us. Visit the link in our bio or go to our website to sign up. We still do have Dr. Ngoa in the studio. Dr. Ngoa is a young physician in Cameroon leading digital health innovation through different platforms and through his clinical practice in rural community. And so, Dr. Ngoa, I know that we have covered a lot about why you started Health Digit program. And I want to pivot a little bit to ask you, how can social media be ethically and effectively used for rural health education?
Thank you so much for the question. And ethics and social media. I like that topic especially because um, it's not because we are talking about social media that means we avoid and we are not allowed to respect ethics. It's just the real world that's moved to the unreal world. But it's the same rule. Nowadays, we are talking more and more about digital health, digital policy, protections of data, and this and that. And social media must be used responsibly. This means fact checking, using inclusive language, and protecting community identities. Yes. And that's why you realize that on another platform we have now what we call the policies. You do have to respect the policies of the platform. We train users to turn, for example, Facebook posts, LinkedIn, or TikTok videos into educational micro campaigns, combining accuracy with creativities. Yes, and let me make some hello to Dr. Platin with his program, Healthy Program, because he's working daily with local communities, especially in the communities affected by the war or this thing. And rural youth respond well to visual and relatable content. And that's game changer in public health messaging. The way people, because nowadays, even when you have headache or something, what is the tendency? The tendency now is to go and check it on social media. And I have one of my lecturer who always said, "Are you a Google? Are you a Google medical doctors?" No, because yes, you can find the information there, but you are not sure that all the information in that place are right. That's why medical professionals, health professionals, do have to engage themselves on social media now, integrate social media on their daily practice. So that's it. And when we be there, we allow them to respect and to teach the community ethics. For example, you have to know that you don't have to snap somebody's in a hospital or in a private place, and you put it on social media. You don't have to snap somebody's medical prescriptions and you put it on social media. So, this is the kinds of issue we avoid. We have to avoid. We also have what we call body shames. We have now a lot of people who come on social media and talk about that. They don't know that it affects people mentally. That's why I also engage myself in the mental aspect of people, not only the communities, but also in social media. And we do have to pay attention. We do have to be kind to the people. You don't know what people are dealing with daily. Yes. So that's why if you can, you have to be kind to the people. So because it's helped them to build themselves. And as we can go back in the story, we know a lot of scandals on social media. We know a lot of famous people who so their mental health decrease and low down due to a lot of unethics approach on social medias. So we do need to address that question very well.
Thank you so much for doing justice to that question. Seriously, I really do appreciate the fact that you are incorporating ethical training in social media use for health education. And my last question for you on this episode, we will bring you back sometime in the future to talk about other things that I have highlighted here that we need to spend time to do. But for this episode, the last question I have for you is, what does community-led innovation look like in your everyday work? Now, this one is very directly related to you. What does that look like?
Okay. Okay. I would like to invite you in my world. I always said, "Welcome to my world. Welcome to my world." Yeah. It means involving the community from the start, not just as recipients, but as co-creators. As I said at the beginning, everybody is a health ambassador. Everybody has to be a health ambassador. And whether it is our music therapy sessions or malaria campaigns, we listen first to co-design interventions. This approach not only boosts trust, but ensures sustainability. Innovation is not always high-tech. It's often low cost, human-centered, and locally driven. So that's it. Try to be kind with people. Thank you so much.
Thank you so much, Dr. Ngoa. Do you have a rural health story that needs to be told or that needs to be heard, whether you are a health worker, a patient, policymaker, or advocate? We want to hear from you. Share your stories at whataboutruralhealth.com, and you would see the link where you can submit your stories to us. We will review it, get back to you for more detail and clarification before publication. This helps you or helps us to spotlight the realities behind the data. So thank you very much, Dr. Ngoa. Do you have any personal message for young African health leaders and rural innovators that you would want them to hear in this podcast? Please do share.
Okay, thank you so much for this question. Uh, regarding health professionals, regarding young African health professionals, to every young African health professional listening today, I see you and I believe in your power. You are not just the future of healthcare in Africa and beyond. You are the present. Your stethoscope is powerful. Yes, but so in your smartphone, your voice, your vision, whether you are in a rural clinic, a crowded ward, or behind a computer screen, you are a change maker. Don't wait for perfect conditions to act. Innovation doesn't always begin with funding. It begins with purpose. It starts with what you have. Where you are, use your story, struggles, and skills to serve. Collaborate, learn, speak up, advocate, and above all, care deeply, not only for your patients, but for yourself and your communities. Africa needs you, not just as a professional, but as a leader with heart. Let's write together, build together, and reimagine what health means for our continent.
Thank you very much for listening to What About Rural Health. If this episode moved you, taught you, or made you think, please share it. Subscribe to our platforms and channels and leave us a review. Do you want to get involved? Head to our website, follow us on all our social media. Our handle is at What About Rural Health, and we are across all social media, and be part of the conversation. I want to leave us with one last word. When technology, compassion, and creativity meet, even the most remote corners can feel seen, supported, and transformed, which is why we continue to ask the question, what about rural health? Let's create this narrative together. Until next time, thank you very much.